I am Dr. Deborah Garozzo. I'm an Italian neurosurgeon. I work here at the Neurospinal Hospital in Dubai, and my subspecialty is peripheral nerve surgery. Carpal tunnel syndrome is the most common entrapment neuropathy. Entrapment neuropathy means that there is a compression on a nerve that will result into clinical symptoms. Carpal tunnel is here. It's a passageway that allows the median nerve to go from the wrist to the hand. It has a bony floor, bony walls, and the roof of the tunnel is a thick layer of called transverse ligament. The first symptoms are generally numbness and tingling, radiating along the thumb, the index, and the middle finger. Pain and numbness can actually radiate all upper the limb up to the shoulder. This is the early stage, but if there is an ongoing compression on the nerve, what happens is that there's going to be some sensory loss on these three fingers, and in the last stage there will be also a motor impairment due to muscle atrophy here in the muscles here, with impairment of the thumb adduction. It is well known that repetitive manual work is actually predisposing to the onset of the symptoms. A lot of people doing a lot of typing, or for instance people working a lot with a computer and using the mouth, or anybody who's doing manual work such as hairdressers or people working with pneumatic hammers, dental hygienists. The majority of the patients that suffer from carpal tunnel syndrome are ladies. First thing that you have to go is that you have to be referred to a physician with experience. Sometimes there are patients that are getting surgical indication for carpal tunnel treatment, but then they do not get any relief from the symptoms because actually they were misdiagnosed. Once clinical evaluation is suggesting the presence of a carpal tunnel syndrome, you should go for EMG. And if EMG and clinical evaluation do support that you have a carpal tunnel syndrome, the best thing is to go for surgical treatment. Surgery is carried under local anesthesia. The skin incision is a very small one, 2 or 3 centimeters long. The procedure is a fast one, lasting from a few minutes up to 15 minutes. Patients are generally advised to immobilize their hand for some days after the surgery, and then they can resume all their daily activities, although they are advised not to do significant efforts with the hand that has been operated for 1-2 months after the surgery. The same night after the procedure, most of the patients are already experiencing complete relief from pain and numbness. Recovery is usually very quick.